Hello, I'm Daniel Camburn. We'll be doing a brief presentation on Chinese medicine's view of endometriosis. Endometriosis is a very broad topic, can be talked about for many, many hours, but we'll just kind of get into an introductory discussion for the time being. Acupuncture and Chinese medicine, alternative methods to stop and reverse inflammation, by Daniel Camburn, MD, Master Herbalist. That is myself. Chinese medicine. So in China, for kind of all of known history, Chinese medicine has been a complex of features: herbal medicine, acupuncture, manual therapy or physiotherapy called Tuina, the exercising energy function or practice of Qigong, which can also be used to heal from one person to another, and of course dietary therapy. And all of these aspects of Chinese medicine have been extremely well developed. In the West, people mostly know Chinese medicine as acupuncture. Acupuncture is a limited modality, whereas herbal medicine in general is an unlimited modality. Acupuncture insertion of disposable, very fine, of course, very thin, fine, and also solid needles. Hypodermic needles are hollow and open at the end, very sharp. Acupuncture needles are rounded at the end, solid. They tend to part cells, causing much less discomfort. Surgical stainless steel is the norm. The needles are inserted into precise locations determined by classical experience, anatomical palpation, and the needs of the patient. And the purpose to elicit intended changes upon the body. Extremely necessary to do palpation in acupuncture because every patient is different. Everyone's body is a certain degree different. And if we're to locate points correctly, then palpation is necessary. Qi. So qi is one of these elusive terms, often confusing to people, but more or less an excellent translation is energy, especially if we consider how broad of a term energy is. So in physics, energy, the capacity for doing work, may exist in potential, kinetic, thermal, electrical, chemical, nuclear, and other various forms. In other words, energy is an extremely broad term, even in science. Qi, therefore, being a term for how, when, where the body does work. And this is a simple way to understand Qi. How, when, where, and why the body does work. So just try to keep this in mind because it's a term we're going to have to keep using. Chinese herbal medicine, all herbal medicine in the world has a certain amount in common in that they're all utilizing natural substances, generally speaking, substances either growing on the planet or, mined, harvested in some other way, not produced chemically. But Chinese herbal medicine, very different from Western, in part because of a much longer, continuously recorded written history. The Chinese were one of the very first to develop writing, and again, along with Egyptians, the Arab world, among the earliest to develop very complex writing where they could relay complicated ideas, not just simple data. So Chinese medicine, again, differs substantially from Western medicine in that Chinese medicine primarily utilizes combinations. It's through these combinations that we're able to accomplish extraordinary feats. Single herbs are quite limited, quite weak most of the time. It's through the combinations that we're able to multiply the power and the ability of herbs to do good. Okay, Chinese medicine utilizes formulas composed as early as 200 AD or so. The books published in 220 AD, Shanghan Lun, Treatise on Cold Damage, and Jinghui Yalue, Essential Prescriptions from the Golden Coffer or Golden Chamber, written by the man Zhang Zhongjing, or Dr. Zhang. Zhang Zhongjing died somewhere around 219, 220. His books are considered published at that time. Formulas from that text are still, many of the formulas, even safely, most of the formulas are considered very safe, very effective, still in common use today. This is an extreme contrast from Western herbal medicine. It's also an extreme contrast from Western medicine, as anyone listening to this probably realizes. So Chinese medicine has always been very inclusive or accepting anything that works. And how this relates to Chinese herbal medicine is that we utilize herbs from as far away as Europe and Africa. And that's going back sometimes hundreds of years, sometimes thousands of years. So Chinese medicine utilizing herbs from Arabia goes back thousands of years. Places like Europe and Africa, many hundreds of years. So this is an example of the inclusivity. And continues to be developed and refined by experience, data, and research. Since around the mid-1800s, maybe even the early 1800s, Chinese medicine has started to employ Western-style research, not always in the way that is most pleasing to Western science, but they've been strongly influenced by Western science's view of how research should be done. So, for example, for the majority of herbs in use, or I can safely say all of the herbs in common use, the LD50 is perfectly established. So if there is a lethal dose 50% for a substance, those dosages are perfectly known, the toxic dosages. For many of the substances we use, there is no LD50. There is no dosage that will kill. And this is true for much of the medicine that we employ. There is no fatal dosage, no toxic dosage. Okay, into endometriosis specifically. So surgery should always be the last resort. In the past, that was consistently true. In many cases today, surgery has become the first choice. Surgery for endometriosis probably is a good idea in many cases, particularly when you're talking about stage 3, stage 4, and you're talking about extensive amounts of tissue. Endometriomas covering large areas, interfering with organic function such as bladder, kidneys, colon, so forth. So surgery can be a very good idea when it is called for. This surgical approach I call working around the body, or physical medicine, physically removing endometriomas and adhesions. Chinese medicine offers a potential cure from the outside in, which I call working with the body, or energetic medicine, changing the way the body governs itself. I think this probably makes sense without further explanation. Okay, so As more time goes by, more causes of endometriosis are suggested. You could also say identified, etc. My experience, I've observed three common etiologies. Acute and chronic stress is what I'm going to say covers 80% of cases. Physical trauma, inactivity, more complicated than it sounds. Physical trauma with and without added toxins. These two make up about 10% of cases each in my experience. So 10%, 10%, 80%. And so in this discussion, we're talking about the acute and chronic stress scenario. So positivity and endometriosis. The picture credit here goes to my brother Bradley, mechanical engineer working on rocket ships and so forth. Positivity and endometriosis. So the conference that I was originally giving this talk at was for the EndoFound, or Endometriosis Foundation of America, endofound.org, a healthy mind, happy pelvis. So my message is happy mind, healthy pelvis. Happy mind, healthy pelvis. Does positivity kind of solve the problem of endometriosis? Probably not, at least probably not in most cases. Positivity may indeed be the long-term solution to ridding the world of endometriosis, and that's what we're going to discuss now. Malariosis theory. Okay, so from the endofound.org website, the quote, "The cause of endometriosis lies in developmental abnormalities in the female reproductive system." Now, just to be more accurate, EndoFound is not saying this is the only cause of endometriosis, just that this is just a quote under malariosis theory. Okay, so quoting the Mayo Clinic, which I find to be a wonderful resource in general, cortisol, the primary stress hormone, suppresses the reproductive system and growth processes. Now, you could find this information anywhere. I'm just taking it from Mayo Clinic. I propose this effect while a mother is pregnant is a very likely cause of pathological misdirection and subsequent malformation of endometrial tissue, thus making stress the primary cause of endometriosis. It's tiny amounts of information, maybe a large leap. It can take a few moments to reflect on this basic idea, right? If cortisol, the primary stress hormone, suppresses the reproductive system and growth processes, then isn't it logical that chronic stress for a mother when pregnant could cause abnormalities, malformation in the reproductive system of the daughters in their womb? If this is so, then there's no need for a genetic component, except that people's response to stress likely has to do with their genetics. Is a growing embryo or a fetus even a miniature version of its mother's experiences? There's a blood barrier. All the same, the hormones that the mother is hormones flowing through the mother will flow into the baby. We have the cortisol factor, but I say, and as yet unknown factors, right? The more we discover about the body, the more we understand that we don't know and don't understand. So these various factors are directly affecting the embryonic organ development. Stress shuts off nourishment to the reproductive system in an adult. Might it not also shut off nourishment to the same tissues in embryonic organ development? Again, these are things to reflect on. These are essentially new theories. Hence, stress causing endometriosis due to disordered function and flow may explain primary endometriosis by way of a mother's stress affecting the child. It's more certain that these effects of stress causing suppression of the reproductive system are a primary cause of adult onset endometriosis. Now, when we're talking about primary endometriosis and secondary endometriosis or adult onset endometriosis, it's very difficult, at least not if not entirely impossible with current technology, to be sure that someone with adult onset or secondary endometriosis did not have it the entire time. In other words, a woman may have had it from pre-birth, but it not be evident. No noticeable signs and symptoms, or signs and symptoms were ignored, just dismissed as normal cramping, normal pain, normal bleeding, even though they were not, and so forth. So it may well prove to be the case that there is only primary endometriosis. That may prove to be the case in the future. And it may be things such as the trauma, the physical trauma, chemical traumas, electrical traumas. I've seen a variety of cases of a huge array of traumas triggering endometriosis. Perhaps that is only possible if the endometriosis is present to begin with. This is as yet unknown. And maybe time will tell, maybe not. Okay, so moving on to our repressive culture and endometriosis. Our repressive culture and endometriosis. So in general, in many cultures, and true in the United States, positive emotions are strongly encouraged to be expressed. And that's great. It's great to be positive. It's great to feel good. But negative emotions, particularly when expressed by females, are very much discouraged to be expressed, but are strongly encouraged to be suppressed. This can be very destructive to reproductive health. And, to recall why, we just need to go back to the Mayo Clinic here. Cortisol, the primary stress hormone, suppresses the reproductive system and growth processes. So the repression of emotion is a substantial form of stress. Hence cortisol, hence suppression of the reproductive system. Chinese medicine has long seen emotions as forms of energy with physical effects. Emotions as forms of energy with physical effects. Regardless of the form, suppressing emotions does harm. In other words, regardless if they're any form of energy or whatever they may be, if we ever know, suppressing them clearly does harm. So what happens to this repressed negative, typically, because there's no reason to repress positive emotions, generally speaking. So what happens to this repressed negative emotion? What does it have to do with endometriosis? So in Chinese medicine, they quite logically say for thousands of years that blood follows the movement of energy. In other words, blood will just sit in a pool, put blood in a cup, it's going to sit there in the cup. It's not going to move around. Put energy in a cup, the energy is going to keep moving. So energy has the ability to move, to change, to transform. So blood must be moved by energy. Endometrial blood tissue is, of course, exceptional. Potential for growth and generation can easily become destructive when energy carries it contrary to its normal pathways. This is just the normal theory of endometriosis, a common theory. Endometrial material traveling where it should not. One of the common theories. several thousand years ago in a book called the Huangdi Jing, or the Yellow Emperor's Inner Classic, written circa 200 BC. The energetic effects of emotions were laid down. Joy makes energy flow smoothly. Smoothly flowing energy, generally speaking, equates to health. Anger causes chi to rise. We can easily see that in the red face people get when they get angry, at least some people. Anger causes energy to stagnate. And this would be pains, tensions, tight muscles, cramps, aches that people get because of anger. Anger causes energy to move chaotically and or conversely. Chaotically moving all sorts of places, generally that it should not, or all sorts of ways that it should not. And conversely, moving essentially just opposite of how it should flow. So, for example, if endometrial sloughed off endometrial tissue should flow out of the body, instead maybe it's flowing up through the tubes, getting into the pelvic cavity. Worry or overthinking, pathological overthinking, causes energy to bind or stagnate. Difference between stagnate and bind, more or less no difference. See if I can define them really at all in comparison. Binding normally is going to have more to do with emotions, stagnation more with the physical body. Fright makes energy scatter and also move chaotically. So frights will drain a person's energy. It's easy to be routinely frightened in a place like New York City, for example. Grief, which is not dealt with in a healthy way, kind of quickly enough, directly enough, if not enough time is given to grief. If grief is allowed to linger and so forth, then grief will cause energy to diminish over time. And fear will cause chi to descend. Again, fear, very, very common in many big cities. Chronic fear, causing chi to descend. And this energy or this chi is descending not in a physiological way, but in a pathological way. So that can cause all sorts of problems. In general, we need a healthy balance of rising energy and descending energy, right? We need certain things to rise, like energy, oxygen, blood to our head, to our brain and the other various tissue, eyes and skin and so forth. We need other things to descend, right? We need the food that we've eaten to descend and process, the bowels, the urine to descend. So when everything is descending, or everything is rising, this is not functional, not good. Okay, science reports that thoughts are electrical and chemical, similar to light, which is a wave and a particle. That science doesn't say that yet. That's just my 2 cents on it. But it's the broad perspective of science at this time. I don't bother having a reference here because it's just the general perspective of science that they've agreed upon. Thoughts are both electrical and chemical. So if thoughts in the brain are 50% energy, again, this is just a number I'm making up. Could be 2% energy, could be 95% energy. No one has any idea so far. But so let's say if thoughts in the brain are 50% energy, then we could say that emotions of the brain experienced in the body are also in some substantial portion energy. Right, if thoughts are definitely in some proportion energy, then emotions are most likely in some proportion, or some portion, I should say, in some portion energy. Newton's third law. For every action or force in nature, there is an equal and opposite reaction. On the EndoFound website, one of the founders, Padma Lakshmi, says or mentions millions of women suffering in silence. Millions of women suffering in silence. There are lots of reasons for that, to do with problems in the medical community and problems in our culture. We can't get into them all at the moment, but this silence can be called repression, holding emotions or energy inwards and downwards. And again, we've talked about that would mostly be negative emotion. So holding emotions inwards and downwards. And Chinese medicine will mostly call this liver qi depression or liver qi stagnation. Those of you who have been to an acupuncturist, herbalist, etc., you may have heard this diagnosis or these terms. No one notices your tears, no one notices your sadness, no one notices your pains, but they all notice your mistakes. Sounds negative, but it's also mostly true. The energy which is suppressed or pushed down cannot simply disappear. Energy can neither be created nor destroyed. First law of thermodynamics, or law of conservation of energy. Energy can neither be created nor destroyed. So if the energy of these damaging emotions, others inconsiderate or selfish behavior, etc., this negative energy cannot simply disappear. If it's not repelled successfully or processed relatively immediately, and again successfully, it will accumulate. It will accumulate. Why? Because energy can neither be created nor destroyed. The more successfully this negative energy is pushed down, in other words, the less we react, the lower it'll go. Generally speaking, the lowest it can go is the pelvic cavity. Technology, not really my thing, but here is a little flow chart anyway. Experience, in other words, a stressful experience, it goes to our mind. We have the default negative response or an opportunity. Emotion, the emotion flows from whether we've gone to our default or the opportunity. Flows from that. Emotion flows from the mind, right? So the emotion is an autonomic response from what we think of our experience. What we think of our experience, the emotion flows from that. From there, we get an intention, almost always unconscious, a process. The body follows the intention. We get the storing of negative emotion in the form of endometriomas, or in the form of cancer, or in the form of cysts, or in milder cases, just constipation or things like that. But shortness of breath or whatnot. But in the case of endo, this would be a logical flow. So as there must be an equal and opposite reaction to the absorption and pushing down of this emotional energy, it cannot simply disappear, right? Law of conservation of energy. Sooner or later, there must be a venting and or a transformation of the suppressed energy. This could be seen in emotional outbursts. Most of us do not allow ourselves that form of venting. So this is how we move right into these forms of inflammation. Inflammation number one, an attempt by the body to vent repressed or simply unexpressed emotion. Again, Newton's third law, body attempting to balance the equation, equal and opposite reactions. Energy, energy as an aspect of emotion, has either been suppressed or stored for future release, which often never occurs. This energy has moved one way and is being held there. We must consume energy to continue to hold it down. Logically, if we're more fatigued, drained, we're fighting off colds, flus, etc., we'll lose the ability to contain the stored energy, and it will vent as inflammation. And we may say, oh, it was because I had that glass of wine, or it was because I had those Doritos, or it was because I had pizza and I only have pizza once a week. And this one time out of the last 10 times I've had it, it was the cause of my inflammation. We don't do it deliberately. We do it accidentally. We look for justifications and explanations of things that take responsibility away from ourselves. I'm not blaming anyone. I do exactly the same thing. We all do the same thing. It's part of being a human being. It's just what we do. So we are never going to be quick to say, I'm having this inflammation because I've been repressing all this stress. That's likely the truth, but it's not what we're likely to say to ourselves. Okay, a side effect of accumulating stagnant energy. For example, unused epinephrine. We neither fight nor flight, so it becomes accumulated. This accumulated stagnant energy easily produces heat. Greater stagnation equals greater heat. Also, anger or frustration easily generate heat. We get kind of a multiplication of energy, of process, of mitochondrial activity, etc. Unexpressed, these emotions create pressure and friction, that is pathologically contained potential and thermal energy. Unexpressed emotion, pressure, friction, right? Potential and thermal energy, maybe among other kinds. Inflammation 3, when the body is triggered to respond to local pathological tissue, for example, the endometriomas or adhesions, there's found a local excess of energy which is easily caught up in the response. So the body responds, there's already a lot of local pathological excess. The two meet, you get kind of an explosion of heat. And she is what contains the warmth, carries it around the body. This local excess can be classified, at least in part, in terms of high cortisol levels. So this is something we can test in blood work. If you have high cortisol levels, you can take that as an absolute proof that you are suppressing tons of stress on a regular basis. Inflammation number 4, overwork and agitation can affect the organs. The uterus, especially the myometrium, wants to expand and contract, as would happen in a pregnancy. Logically, there's a direct relevance to the formation of fibroids there. Fibroids generally occur more so with age and much more so in women who have not had a pregnancy, much more so. The endometrium wants a rest from this constant monthly shedding and replenishing, wants to transform right into placenta, decidua, etc. It wants to go through its processes, which for our ancestors would have been a regular occurrence, right? Every 18 months, every 2 years, from kind of 14 to 45, just banging them out, constant process, a growth and expansion and contraction and transformation. So when the body tissue, like our greater selves, does not get what it wants, it tends to grow stagnant, lack of sufficient use, tired, too much shedding and replenishment, and agitated. An effect of the previous two, not being used, being drained, right? Not being utilized. Just like ourselves, if our skills are not being utilized or not being used for what we like to do and can do well, we get stagnant, we get agitated. This occurs also from lack of exercise. We don't exercise, we get stagnant. It's very straightforward. Agitation, effect of these things. Agitation, goes right back to this one. Anger, frustration, generating heat. Stagnation, generating heat. So we can go, just because of this lack of use and this fatigue of shedding, we go right back to inflammation. Okay, inflammation 5, when we suffer from fear or anger, consciously or unconsciously, the adrenals release catecholamines, such as epinephrine, which causes an increase in heart rate, muscle contractility, blood pressure, and sugar metabolism. And the increased blood glucose coming from the breakdown of liver glycogen. In other words, stress causes the liver to give up stored sugar. This triggers sugar cravings. In modern times, the standard sugars available are highly refined, extremely inflammatory foods. This is from WebMD. They're sourced. Hopefully, they don't mind me using it here. Surprising sources of sugar. Many of these things, why did they put them? Because they're things that people would think are healthy. Pasta sauce, granola bar, yogurt, coleslaw, salad dressing, oatmeal, tea, dried fruit, ketchup. Either just perfectly normal things like ketchup, right, pasta sauce, or things that a person would think are maybe even especially healthy. Granola bars, oatmeal or oats, salads, yogurt, right? Dried fruit, super healthy things. And they're telling us these outrageous numbers of grams of refined sugar, severely refined sugar, in the average serving. Look at 8 ounces of yogurt. Average could be up to 33 grams in an 8-ounce serving in a cup. 33 grams. Now, a gram spoon is a little spoon that's about typically, gram is a weight and a spoon is a volume. So, they're not exactly the same thing. But a normal, say, gram spoon that covers a lot of powders or granulated substance will be about as big as a half teaspoon, thereabouts. And so if you just think about a half teaspoon, you'll be approximate. And so if you imagine that little half teaspoon measurement, if you do any baking, and imagine taking 33 level scoops and putting that in your 8-ounce serving of yogurt. 33 scoops. And so when we get stressed, we seek sugar. We go for sugar. We think it's fine because we're having a salad, right, or we're having oatmeal. Much of the time, we're getting tons of refined sugar, and the ubiquitousness, the ever presence of horrifically refined sugars in most industrialized societies is almost beyond belief, and it takes some looking into. Okay, so creating a happy mind and a healthy pelvis. How do we do that? Directly face and address stressors, both past and present. Right? I would put future here, but that's not really possible, at least as far as I know. No time travel yet. Acupuncture. Acupuncture has been very well proven to be able to reduce inflammation. So we reduce inflammation, we reduce pain, we can regulate nervous system, circulatory system, limbic system, endocrine systems. In fact, the effects of acupuncture are being expanded all the time. It's truly incredible. Exercise, especially things where we move a lot, like dance or aerobics, helps to vent this accumulating energy. And of course, toxins like the residual stress hormones. Another wonderful way to create a happier mind and so forth, and therefore a healthier pelvis, is regular stretching and controlled breathing. So, of course, this is very easy to accomplish in something like yoga, depending on the type of yoga, and Qigong practice. So stretching to open up constricted or tightened areas, controlled breathing to reorder the functionality of the body, the Qi dynamic. Diet, very simply organic, whole foods, strictly avoiding chemicals. On my website here, danielcamburn.com /docs, DOCS, you'll find a good amount of information on what is a healthy diet. Okay, herbal medicine for happy mind and healthy pelvis. I don't know where I can put myself. I'll put myself in the beautiful nature here. Okay, so herbal medicine, circulate energy and blood to relieve pain. Circulate energy and blood to relieve pain. We're going to get into all of these in a few moments here. Invigorate blood to dissolve blood clots and thereby reduce pain, or directly related to reducing pain. Dissolve masses, reduce adhesions. Stop excessive bleeding. Directly increase resistance to negative experiences and stress. Heal the effects of chronic mental emotional strain. Provide the energy and motivation necessary to heal. Greatly increase fertility. And of course, pregnancy may decrease or even eliminate endo. And we'll talk about curcumin, turmeric. And many herbs. There is no herb that's for everyone, but we'll get to that in a few moments. Okay, so Chinese herbal medicine, many materia medica were discovered in ancient times, far more over the last 1,000 years. In all cases, the herbs we use have been continually researched and simultaneously well documented. And we're talking about for 1,000 years at least. This tireless and enduring effort tells us exactly what the various materia medica can do. That includes in what combinations, in what dosages, when and how they must be harvested and stored and processed, and so on and so forth. The Chinese materia medica includes plants, minerals, animals. Generally speaking, it's about 80% plants, 10% mineral, 10% animal. In my own personal usage, it's about 90% plant-based, 9 mineral, 1% animal. Meaning also that 99% of the formulas that I prescribe for patients contain no animal ingredients whatsoever. Herbs to relieve pain by moving energy and blood. We've discussed that qi means energy and/or function. Any and all malfunction of the body will likely include qi stagnation and/or a disordered movement of qi. So Chinese medicine has long said that pain is stagnation, stagnation is pain. Pain is stagnation, stagnation is pain. So you can see if pain is stagnation, how relevant and useful some things like exercise and stretching can be to relieve pain. I feel like I want to be more centered here. There we go. Herbs which can move the qi, those which can move the blood. And of course, those which can do both, such as turmeric. Herbs to invigorate the blood or dissolve blood clots and reduce pain. So in Chinese medicine, we have a category of herbs called invigorate blood. In that category, there's a huge array of strength. And this is true of, say, certain pharmaceuticals, but in general, it is not true of pharmaceutical medicine, what I'm about to say, which is that in herbs, we can very often increase the dosage to produce a stronger effect. And we can use stronger substances, and we can use higher dosages. So between the substances that we choose, the way the herbs are processed, the way they're combined, and the dosages we use, we can be tremendously precise at relieving pain through moving the blood. And this moving the blood overlaps with, it's part of dissolving masses. It's part of dissolving masses, tumors. Okay, so additional categories of herbs related to dissolving tumors. Western medicine has various methods to dissolve tumors. In general, the Western perspective of endometriosis is that nothing but surgery can dissolve the tumors. For nearly 25 years, that has not been my experience. My experience has been that the right herbs can absolutely dissolve endometriomas and adhesions. And this is a perspective in China as well. This was the perspective I was taught, and it's been my experience. In Chinese medicine, we dissolve tumors by encouraging the body basically to function better, to do its job. Categories of herbs such as warm and transform phlegm cold, which includes nodules, cool and transform phlegm heat, again including nodules, regulate qi, draining dampness, clear heat to relieve toxicity, and so forth. So we have a wide variety of herbs that we combine in particular ways related to a specific patient in order to dissolve these tumors. It's something more or less that Western medicine entirely lacks the ability to do. Herbs to stop excessive bleeding. Stopping bleeding is a highly essential part of medicine, right? It's quite easy for us to bleed out and die. The Western treatments for stopping bleeding are not particularly well developed. The Western treatments are generally hysterectomy or ablation. And ablation, basically the destroying of tissue, electrical, other kinds of extreme heat, burning tissue, scarring tissue, and surgical resections, hysterectomies, etc. These are the treatments for bleeding. They're extremely harsh. In Chinese medicine, we have a category of herbs called stop bleeding. In this category, we treat according to the source of bleeding, the area of bleeding in the body, whether the bleeding is related to fatigue or deficiency, related to heat or cold, related to trauma, etc., etc. And we can just increase the strength of these stop bleeding herbs by what herbs we choose and what dosage we use. So generally speaking, it's 95% of the time for endo patients, I have been able to, and including things like Crohn's, ulcerative colitis, I've been able to stop bleeding very effectively. So it's something I do very consistently for patients, and of course has a tremendous value because there is no analog really in Western medicine to herbs to stop bleeding. Herbs to directly increase resistance to negative experiences and stress. Increasing resistance to stress has several forms. First, if you have sufficient energy in general, you're liable to have sufficient energy to resist being dragged down by negative people or experiences. If you are running more fatigued, run down, exhausted, then you really don't have the ability to resist negative people, negative experiences. So in Chinese medicine, we have tonic herbs, tonics. Everyone has heard of ginseng. Ginseng is a powerful tonic, tremendously well proven to increase a person's resistance to just about anything. Poisoning, starvation, extreme cold, extreme heat, etc. These type of herbs are called adaptogens. They make a person much more resistant to the negative effects of stress. Herbs to control the mind and emotions, to forcefully keep us calm and at ease while still engaging in the world. So we have categories of herbs called things like nourish the heart, calm the spirit, anchor the heart or anchor the mind, calm the spirit, aromatically open the orifices so that consciousness can be more clear. We can see things more clearly. And these overlap with all kinds of other categories. In other words, in Chinese medicine, we're tremendously able to keep the mind calm and relaxed if you're taking the medicine, right? The medicine, the herbs only work if you're taking them. If you're taking them, you will be calm and relaxed. Herbs to heal the effects of chronic stress. So chronic mental emotional strain will weaken us physically, mentally. The effect is exponential over time. We get worse, not better, at handling stress as it accumulates. Right? A person would say, "Oh, I exploded because I had taken all I could, or that was all I could handle, or something like that." Right? If you're overloaded, somebody's loading you up. Carry this, carry that. Can you carry this also? You don't get better at carrying things. You get more and more overloaded, more likely to collapse. So that which doesn't kill us makes us stronger. 100% wrong. For the human experience, that which doesn't kill us makes us weaker. Generally speaking, that which doesn't kill us makes us weaker. We are not really meant to be injured. Our healing ability is limited. So Chinese medicine, as I was just discussing, has these tonics, something Western medicine chooses to not employ. The tonics can rebuild the damage done by stress, and we can heal the mind and emotions. So we can heal the trauma of the past, we can heal the trauma of the current. And it's relatively quite inexpensive, in part because it's generally quite fast. Very often within months, a person is entirely healed of a lifetime of trauma. No exaggeration. Herbs to provide the energy and motivation to heal. Often the mind is willing, but the flesh is weak. We may find ourselves wondering why our body has not finished healing after a surgery, even though years have gone by. Or we're giving up hope, failing to act, even though we found that regular exercise, proper eating, acupuncture, meditation, etc., all help tremendously. But we're still giving up hope and failing to act on doing these things. Right? This is the lack of energy to heal. With the right tonics, with the right regulation of emotions, the relief of pain, reduction of inflammation, boosting of willpower, right? We can motivate the body, give you the energy, the motivation to do these things that work so well to heal one of endometriosis. Herbs to increase fertility. So Chinese medicine has been obsessed with fertility for thousands of years, hence extensive knowledge on the subject, right? There's extensive knowledge. Even how to prevent a threat of miscarriage. For many years, it's been known that pregnancy will decrease endometriosis. It might even cure endometriosis. Fertility is often greatly reduced by endometriosis. And Chinese medicine, in contrast, has the ability to increase fertility, right? Endo decreasing fertility, Chinese medicine increasing fertility. So various tonics regulating menstrual cycle. Western medicine has the oral contraceptive pill, or contraceptive drugs used in other fashion or administered in other ways, intravenously, etc., injections and so forth. But we have many herbs in Chinese medicine to regulate the menstrual cycle. It's something we can do amazingly well. Much of the time in Chinese medicine, when we are increasing fertility, one of the main ways we're doing that is by regulating the menstrual cycle. We regulate the menstrual cycle, we regulate and improve physical health. A person's fertility drastically increases. Okay, so many people with endometriosis are utilizing curcumin. And curcumin, like every single herb on earth, is not for everyone all the time. So we've been using it in Chinese medicine for thousands of years, calling it jianghuang, or yellow ginger, ginger yellow. And this isolated extract of curcumin is by comparison very, very new. Very new. Will it do good or will it do harm overall? Unknown. It's still much too new. When we keep entire substances, we keep a plant as it comes from the earth, there's always a balance there. There's always a harmony. And it's not always easy to see or know what all the various phytochemicals are doing in a plant, even if we find one that seems to be the active constituent or the most active constituent. Actions or functions of Jianghuang in Chinese medicine: invigorate blood and unblock the menstruation, promote the movement of energy and alleviate pain, expel wind and promote the movement of blood. And even though turmeric is a food, it's an herb, right? It's used widely in India to counter the effects of veganism, which is being cold and blood deficient, which leads to blood stasis. So turmeric is an example of countering the effects of veganism. But aside from those low doses that you'll get in food, it's an herb in Chinese medicine that we would not prescribe for someone to take for a long time continuously. We would use it kind of as needed to correct a problem and then cease the use of it. So we say in Chinese medicine the flavor is acrid or spicy and bitter, temperature is warm. So acrid can be good to break up and disperse stagnation. It can also be draining or depleting, especially if you're deficient or weak already. Bitter flavor drains downward, can remove pathogens down and out, bowels and urine. Again, if you're already more deficient, this could be draining or depleting. The warm quality, warm can be great if you're cold. If you're not cold, if instead you run quite warm and you're really prone to inflammation, then this warming effect that you're still going to get in the curcumin could be quite negative, and especially with higher doses, concentrations accumulating over time. Okay, so we've just covered the potential dangers of curcumin abuse, so it's an ideal time for us to say you should seek an expert. Seek an expert, do not self-employ herbal medicine. Peppermint tea, for example, in China is an herb in the category of cool, heat, and relieve toxicity. Not used as a beverage, used as a medicine. It's quite cool. So even these very commonly self-prescribed substances are prescribed by undertrained practitioners: black or blue cohosh, evening primrose, vitex, dongguai, can be very, very harmful being self-prescribed or prescribed by undertrained practitioners. And no, I'm not saying these are always bad, just when they're misprescribed. So herbs are very powerful medicine. Herbs were the primary medicine for all of human history. And this remains true for safely more than half the world today. So make no mistake that herbs are very real and powerful medicine. My conclusion: tremendous power in controlling our own environment while seeking and focusing on the positive aspects of life. This is where our power lies. Bob Marley has the awesome line: emancipate yourselves from mental slavery. None but ourselves can free our minds. And in conclusion, thank you. Peace to us all. And please contact me with any questions. Be well.